We're looking at this week's health headlines. Joining us is WGN Morning News medical contributor and Northwestern Medicine physician, Dr. Lauren Streicher. Good morning.
Good morning.
Men and birth control, what are the studies saying? Will men even take it?
Exactly. You know, the quest for male version of the pill has been going on. I mean, we're talking since the 1970s, 50 years, and there's still nothing out there other than vasectomy and condoms. It always falls to the woman. But there are a bunch of things in development that are getting kind of close. So the question is if there is something out there, are guys actually going to take it? Now, there's a bunch of studies that have looked at this, and over 50% of guys said, sure, I would take something. But all of those studies have been in guys from all age groups. And the truth is that the most vulnerable population, the ones that we have the most unwanted pregnancies, are in the 20 and 30-year-olds. So a new study was just released that specifically looked at guys from 18 to 35 and asked them 3 questions. If there was a male contraception, would you take it? If you wouldn't take it, why wouldn't you take it? And what would be your preferred choice? And they had 2 groups of guys. They had graduate students and guys that went to a public health clinic. So overall, I don't know if this is good or bad, Larry, you're gonna have to weigh in on this. 45% said, yes, I would take something. 30% said, maybe. 25%, no way, no way. And then when they broke it down, the guys that were more educated were more likely to take it. And if they weren't going to take it, they said, well, I'd be worried about side effects. The guys that were a little less educated said, I wouldn't trust it. I don't think it's going to work. But this is what surprised me. This is what surprised me, is they had the choice of a pill, a gel, or an injectable. And most of the guys said they would prefer an every 3-month injection. So, Larry, I'm going to throw this one to you. What do you say to all that?
I think a lot of the guys are just making excuses not to take it because they know they're irresponsible and will forget.
I think there's that. And then the other thing is it's one thing to say you're going to take it. It's another thing when they put the pill in front of you to say, okay, swallow, you know?
Yeah. All right.
We'll see. We'll see.
All right. Let's talk about the relationship between birth control and cancer.
Yeah, I mean, let's face it, we're still relying on the women. And for the millions of women who do rely on taking the pill, there's always this ongoing concern. Is it going to cause problems down the road? Am I going to get cancer? Am I going to get breast cancer? And even though I've mentioned, I don't know how many times, that the pill actually decreases cancer, there's still this concern. So this new study just came out, which is huge. We're talking 250,000 women over a 20-year period of time that looks specifically at the relationship between the pill and cancer. And what they found is, yes, the pill does decrease some forms of cancer, and the longer you take the pill, the better. So specifically, in women who took the pill for over 20 years, there was a 40% decrease in ovarian cancer, and there was a 60% decrease in uterine cancer. And there was absolutely no impact on breast cancer. So this is really important news, because I don't think that male contraception is right around the corner, and I think women are still going to be the ones in charge of all of this. So this is reassuring.
All right, acupuncture and hot flashes. Does acupuncture work?
Well, you know, look, acupuncture has been around for a long time, over 2,000 years, and it has been proven to be an effective treatment for a number of medical conditions. But, I mean, face it, there are claims that acupuncture helps everything, including hot flashes. And the science and solid. So despite a lot of very enthusiastic testimonials from a lot of my patients and women, it's not something that I've really been putting out there and offering to people to use as a non-hormonal alternative. But there was a new analysis that just came out that looked at a lot of studies about acupuncture. And what it did is it looked at the more scientific ones, the ones that actually used a sham needle, compared it to placebo. And it specifically compared acupuncture to non-hormonal methods of of hot flash relief that seemed to work. Things like some of the antidepressants or some neurologic drugs. And this is what they found, is that it wasn't just any acupuncture, it was a specific kind of acupuncture, electroacupuncture, in which there's actually a very mild electric current that goes between the 2 needles. And in fact, that specific kind of acupuncture did work as well as some of these non-hormonal prescription drugs that we use now, like paroxetine and gabapentin. So this is something that I think, you know, we can add to the list of things that might give hot flash help to women who want to avoid estrogen or can't take estrogen.
All right, and spanking may change your child's brain?
Spanking. You know, talking about spanking, I feel almost like it's talking about politics. It's so controversial and people feel so strongly about it. But all the child experts, the American Academy of Pediatrics, the American Psychological Association, have all come out strongly condemning spanking and saying that it is bad for kids. And the good news is that acceptance of spanking overall is shrinking. There aren't as many parents who are routinely spanking their kids, but there are still those parents who say, yeah, if it's well-timed, if it's deserved, this is how you discipline your kids. But spanking has been proven to increase, not decrease, behavioral problems, and it's associated with aggression, depression, anxiety. So this new study actually tries to figure out why that is. And what they did is they did MRIs of brains of teenagers who actually had been spanked and not been spanked, and excluded anyone who'd had any kind of physical abuse or violence to get those out of the picture. And what they found is that in kids who'd never been exposed to violence, who'd never been abused, but who had been spanked, that their brain changed in the same way as kids who had experienced violence, as kids who had been physically abused. So this again reinforces what the experts have been saying all along. Don't spank your kids. Not only does it not work, but it causes bad behavior, it causes aggression, it causes anxiety, and it actually changes their brain, and not in a good way.
All right, for more, you can check out drstryker.com or follow her on Twitter. Thanks, Dr. Stryker.
Thank you, doctor.
Thank you.